So chelation is basically to prevent angiography and angioplasty and bypass. So it's an alternative to bypass. It's a really very good therapy. We call it biochemical angioplasty also. You need not have to undergo any surgical procedure. You have simply by giving medications, you can your blockages are cleared.
Hello and welcome to the India Parenting Show. Today we have with us Dr. Madhu Gupta. She's a diabetologist, but she's right now focusing on chelation therapy. Chelation therapy is now a new alternative to bypass and to angiography. So let us now hear from her how do patients deal with it and how can they avoid bypass and angiography. Welcome Dr. Gupta to the show.
Thank you. So chelation is basically to prevent angiography and angioplasty and bypass. So it's an alternative to bypass. It's a really very good therapy. We call it biochemical angioplasty also. You need not have to undergo any surgical procedure. You have simply by giving medications, you can your blockages are cleared.
What kind of medication are we talking about? Are we talking about chemicals or are we talking about naturopathy? What exactly are you talking
No,
about?
no, it's not naturopathy. It is totally allopathic treatment. Whatever injections we are using, a cocktail of injections. So
Okay.
whatever injections we are using is all allopathic injections. There is no Ayurvedic or no other alternative therapy.
Okay. So how exactly does it work?
See, it chelates out. Basically, the basic principle is that it chelates out whatever plaques. See, you get attacks and all because of blockages in your blood vessels. So
Correct.
it chelates out the calcium from the blood vessels. And because plaques are made up of calcium and lipids and lot of things, so it chelates out calcium. It makes the plaque soften and slowly it removes plaque from your blood vessels, and the arteries get opened up.
I see.
Yes.
So, can a person who has got like a severe blockage can also come to you, and how long would it take, and what is the guarantee that it will go away?
There is a procedure see, whenever patient comes to us, we take their ECG, we do angiography. Angiography is a diagnostic tool that whether he is having blockages or not.
Yes, yes.
So once they are diagnosed with the angiography, or maybe sometimes simply by seeing ECG also we can make out that patient is having blockages.
Right,
So we advise them to go for the chelation therapy as per the patient wish, definitely.
right.
So yeah. So and again, it like if there is one blockage or three blockage or 20 blockage or 25 blockage, all patients they are suitable for the chelation therapy. And
Okay,
same procedure is followed for all the patients.
okay.
Not like that if you are having one blockage, then you need you have some different medications,
I
or
see.
if you are, yeah.
The
So
frequency would be the same. Okay, so now tell me one thing. Exactly how does the chelation therapy work? How often do you give the injections? How many injections? And
yeah,
what is the side effect? Just please
yes.
share with us.
See, how does the injection? See, we give injections in IV line. So it is given in directly in with the saline, and it is to be given in IV line. Like you are taking saline in any hospital,
Right.
and it goes for the one bottle will go for around. It will take around 2 to 3 hours. We cannot
Right.
give it direct push or something like that. So,
Right.
we have to give it slow IV injections, and number of injections are there in that saline. So it has to be given slowly. Then number of sitting depends on what is the level of blockage. Like if you are having 90% or 99% or one blockage or multiple blockage.
Right.
So number of sitting depends on that.
Okay.
If you are having less blockage like 80%, 90%, then it can be cleared with simply around 20 sittings or 30 sittings. If your number of blockages are more like multiple places, you have 99% blockage, then we can give extend sittings up to 50 sittings also.
Okay. Okay.
Yes.
Now, and
And
what is the frequency of the sitting? Would it say once a week or how does it work?
usually we give it twice a week, but if
Right.
patient is having urgency, or we see other factors also like diabetes, or patient is from outstation, then we can little we can give it more frequently also. But usually if patient is very comfortable and is not from outstation, so we usually advise that twice a week is sufficient. Yes,
Okay.
and patient can take it on OPD basis. No need to get admitted.
Yeah.
Patient can sit, patient can sleep, patient can read the newspaper, whatever activity they are.
Correct. Correct.
It is
Correct.
a walk-in sort of therapy basically.
Okay, okay, okay. So
Yes.
now what kind of, okay, so two things. First of all, what are the side effects? What are the possible side effects of this treatment?
Yes. So if patient is suffering from kidney disease,
Right.
their creatinine levels are high, then we cannot give them chelation therapy at all.
Okay.
Because whatever the chelating products are there, like calcium plus whatever EDT and all that we are
Yeah.
giving, so they get excreted through the kidney. And if kidney is compromised, then we cannot advise them that because that will not be excreted out. So we cannot give at all to kidney patients basically.
Okay.
Otherwise, all other patients are suitable candidates for chelation therapy.
Right.
Any age, see, we have given chelation to 25 years to 80 years of age.
I see.
So
But
any age is
right. Okay.
advisable.
So now, if you eliminate the people who have got kidney disease, right? What happens to the normal people? Because if they don't have any kind of disease for that for kidney, can do they? What kind of side effects do the other people get?
Otherwise, there is no other side effect. See,
No side effects at all.
no. Some patients they just take it for rejuvenation also.
Oh,
Like it
really?
removes toxins. Yes. Even without any blockage, some patients they just read on online and this and that, and they just come to us, madam. We want to take 10 sittings or 20 sittings.
Oh, really?
Just yes. Remove toxins from the body and that sort of thing. Yes.
This is like the new
Preventively. Yes. Some patients they take it preventively. If their parents are suffering from cardiac disease, they take it preventively.
Okay.
So it is,
But does
yeah.
it make sense to take it if you don't have blockages? What
Yeah,
happens
you
if
can
you don't have blockages?
100% you can take. Yes.
It's basically just like an antioxidant or basically detox.
Antioxidant and yeah, rejuvenation sort of thing.
Right.
And one more thing I'll tell you, sometimes we combine chelation along with ozone therapy. That is a different therapy basically. I don't know whether we can discuss it. Ozone is simple, it is O3. So
Okay.
nascent oxygen is created, and that is again it's a very powerful antioxidant. So it gives wonderful effect when we combine it with the ozone therapy.
But would you give the ozone therapy for heart patients or that's only for rejuvenation and looking better and
Ozone is for all patients. We can. A lot of indications are there for ozone patients, but for a couple of our heart patients, especially, we have combined chelation with ozone alternatively, and it has given really wonderful results.
right.
Yes.
So now you've actually seen the blockages go down. Like how long, if one starts taking it, how long, when would they see the effect of the blockages getting resolved?
Yes. See, usually it depends again on patients. See, how we diagnose that patient is getting relief with the after taking chelation therapy.
Yes.
So patient they themselves tell us. We did not have to ask them. They
Okay.
themselves. They usually what they say, madam. Previously, I was unable to walk even up to 5 meters.
Right.
Now my walking capacity has increased.
Okay. Okay.
So that itself shows that their blockages are removed basically.
Right, right. So have you seen patients who have got a very high blockages and have got zero blockages after treatment is done, maybe after 6 months or something, would you say? Three
No,
to
no.
six
You
months?
see, even after 10 sittings, usually we tell patients when they come to us first time, usually we tell them that after 10 sittings, you will find some improvement in your symptoms, basically.
Okay.
Like your walking capacity will increase or your breathlessness will go down. And so usually they get it and they themselves will tell us. And what was your questions? I just forgot. Yeah.
No, I want to say that how soon can one expect results?
Yes.
Like it is
Yes.
3 months, 6 months.
No, 6 months. Usually, maybe around 1.5 months to 2 months, they start
Wow.
getting, yeah, good results.
Excellent,
Yes.
excellent. So now, okay, so then I think it would be a no-brainer. If there are no side effects, as you are saying, if there's no,
Yes.
if there are no side effects, then one
Yeah.
should definitely try this before they go for a bypass or they go for angioplasty, right?
Yes. Yes.
So,
Yes.
so now, so if that is a no-brainer, what about the costs? How does it compare to a bypass or
It's
to
very,
a
very, yes. It's very, very less than the bypass and angioplasty. That's why
really?
it is not accepted. I think I should not say something on this platform because it's a public platform, but that's why it is not that marketed basically
Right? Yes,
because
yes.
there is no money in that in this therapy
True,
basically.
true, because the bypass definitely goes in lakhs,
Yes,
couple of lakhs for sure.
yes,
So,
yes.
if you're okay with revealing some pricing or some costs say 10 sittings would cost how much if you can
It
say
is
that?
around 15, 10 sitting. See, per sitting usually it is between 1500 to 2500. Depends on what doses we are giving,
Right,
and
right,
yes,
right.
it is around that. So, and usually it is charged per sitting cost only.
So if you have 10 sittings, that's 25,000. If you have 20 sittings, that's 50,000. So in 50,000, you
Yes,
think there'll be a huge improvement.
yes,
I think that's a no-brainer, and I think that
yes,
you are revealing a secret that very few people know about. So
yes.
that's really very good to know. And there's no side effects, and you can only look
No,
better.
no side
You can only
effect.
feel better, look better. Wow,
Yes,
excellent. That's really good
yes.
news. Okay, so now what who discovered this therapy? I mean, for how long has it been there, and how come people don't know about it?
Actually, how come people will know about is like online platform is the Google and all this is the platform, because we cannot market our product. This is our limitation. Doctors has their limitation,
Right.
but usually it is in UK also, US also. It is given in UK. It is they cover it under Mediclaim also.
Wow. So
Yes,
it's got
FDA
FDA
approved.
approval.
Yes,
It's got FDA approval. It's all
yes,
on
yes.
board. It's not like an
Yes.
alternative therapy.
No, no. It is not alternative therapy at all. All
Wow.
allopathy medicines we are using it. Yes, yes.
Excellent. Excellent. Very nice. Very nice. And
And
so, do you have specialized clinics for this, or any clinic can do it? Like as long as the injections are there, as long as the specialist doctor is there, of course.
no, no. Anyone can do it. Like you have to definitely get trained for it. Like
Yes,
what
of course.
doses, which patient, how to select patient. Because there are some restrictions that if patient is having ejection, like some factors are there. Ejection fraction is very low. Already their heart is working only 15-20%.
Right.
And usually we have to adjust doses and fluids and all these things. Lot of
Correct.
things are
Correct.
there.
But like no special equipment required, correct? From what you are saying,
Nothing
no
is
special
required. It's simple IV line.
IV
Yes.
line.
As you are
Wow.
taking saline, it is simple that way you have to. Like
So
you can go for the work after taking in chelation therapy. No need
wow.
to take rest and all these things.
So like the session would be like about 2 hour session, you think? Like the IV would take about two
Yes,
hours?
yes. It has to be minimum 2 hours, maximum 3 hours. Yes.
I see. So
Two to three.
now I'm getting excited. So can you be doing something else like having a Zoom meeting and also taking the IV dose for chelation? How does it work? Is it as simple as that?
It is very simple actually. It is like you need not have any special equipment or special setup or special timing, or you need not have to take leave from your office,
Right.
whatever morning, evening, whatever time is comfortable to you. And
Okay.
there is no side effect. So even after taking, what we advise is usually we usually tell them that you should have your proper breakfast and come to, because it reduces sugar levels also.
Right.
So we cannot give it empty stomach, and
Right.
because it again it helps in diabetes also.
Right. Right.
Yes,
Excellent. Very nice. This is really that's I guess where you must have picked it up because you're a diabetologist. You must have
yes,
found that as a way to get into
yes,
this field,
yes,
right?
yes. Sometimes patient they come with the symptoms of, they complain of hypoglycemia after taking chelation. So, but that is we don't claim it basically, but that is a added advantage basically.
Right. Right.
And we do keep on checking their creatinine levels or their kidney status every fifth sitting basically. If they are like, usually I have till now we have not seen any patients is undergoing renal failure after taking chelation and all that. But we always do check their levels,
Right.
lipid levels and creatinine levels while undergoing chelation therapy.
Right. So like once you're cured of this thing, you don't have to have like you don't have to keep coming every month or every 3 months, every 6 months for you don't
No,
have to
no. Once you have completed your course, then usually we advise them to take one sitting every 3 months. Every
lifelong,
3 months, only one sitting. Yeah,
lifelong you would say.
lifelong. Because whatever the blockages again will be added to your arteries, that will be removed simply by one sitting. Yeah.
Correct, correct. Do you have
Yes.
to change your diet when you're doing this chelation therapy? Do you have to change your lifestyle or diet?
Yes. See, if you are a cardiac patient, you have to change your diet 100%.
Right,
That is there because see, it is basically because of lipid accumulation and blockages and all that. So you have to have low fat diet. You should exercise. Whatever the routine lifestyle changes are advisable for any diabetes or
heart,
cardiac patient,
correct, yes.
it is advisable for chelation therapy also.
Okay, 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 fine. And do you do chelation therapy for kids also? Although I don't think that kids really need to go for bypass or something, but in case they have any okay, my question is, suppose the kids have got it from their parents, whatever, some heart disease, they're more likely to get it.
Yes.
Would you have something for kids also? I mean, this is for what age? Chelation therapy, what
If no, if kids are getting heart attack and something like that, their reason is something different. They might be having that we usually call it familial hypertriglyceridemia or familial hypercholesterolemia. So usually their cause of blockages is that. So we have to remove that factor,
okay.
and usually we don't advise below the age of 20 years.
Okay. Okay.
Yes,
Fine,
because
fine.
their cause is different. Their cause is not. We have to remove the cause basically.
Yes, yes. And that, yeah, that could be a physiological cause, not necessarily a cause related
Yes.
to
Yeah.
blockages. That's
Yes. That
blockages
is
are, I
not
would say, more
aging or yeah.
lifestyle. Blockages are
Yes.
more lifestyle, I would say, correct?
Yes.
Of
It's a
course.
lifestyle disease. Yes.
Right, right,
Yes.
right. Okay. So this is great. This information is really great, and I think that you have shared a secret which I think very few people know about. So I think it'd be great if forget parents, anybody could actually do this. And the beauty of
Yes. Yes.
something you've shared is that I can do a chelation while I'm having a Zoom call with you, and
Yes.
we and I will start looking
Yeah. You
I
can
don't
take
know,
it.
healthier
Yes. Yes.
and
In
younger.
meetings, you can take it. No problem.
Correct, correct, correct. That's really very good. So, doctor, have I missed something that people should know that in my question? Would you like to add something I've missed? Anything that you think?
Only thing is awareness in the public basically, and I don't know because still people have some people are in dilemma whether they should go because it's a slow process. See, angioplasty and bypass is got like angioplasty is done within half an hour and you are all right.
Right.
Your blockages are removed. A
Yes.
bypass your surgery is done and you are all
Right.
right. But
Right.
it's a slow process. So
Right.
you have to have patience of maybe minimum around 1 month to 1.5 months. Then only you will start getting your symptoms improvement in your symptoms basically.
Right.
So
Right.
that is very important. And second thing is, as I told that we have to keep a watch on kidney profile and all that. But I think it's a very good therapy. Even my parents and lot of my family members, I had given them.
And it has worked.
Yes, yes, it
Yes.
is well
That is
accepted.
that's
Yes,
good to know.
and I'll give you one example. Actually, we had one patient of around 75 years of age.
Right.
He was, he had multiple blockages, and he was refused by all physicians that we cannot do anything for you. Like you have
Right.
to live like this only. We gave him chelation therapy. We gave him 50 sittings, and he was so happy that he used to say, "Ki I cannot eat food also just because after eating food I get pain. Even that much exertion he was unable to
Oh,
tolerate.
right.
But after completing his therapy, he used to say, I am going to water park and I am jumping and this and that. So that good result it gave to him.
Right.
Even we were very happy.
Very nice, very nice, very nice, excellent. And so this chelation therapy, is it taught in colleges, like medical colleges?
No, it is not taught in medical colleges, but in our some good textbook, there are small articles are there. But
Right,
as I told you, I cannot disclose on this platform that it will not be accepted by publicly actually
right. There are stronger
because it is
lobbies.
not a money making
Right.
industry at all.
Correct, 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 correct. There are stronger lobbies,
And
absolutely.
I know few cardiologists, they are giving chelation therapy. They are
Oh,
giving, yes, yes, they are
oh,
giving chelation
wow.
therapy.
Those are the evolved souls who believe
Yes,
in curing the
because the
patient.
results are really good. Yes.
Right. Yes,
So
very nice.
even after bypass, you can get second blockages.
Yes,
Even after angiography, suppose angiography you find one blockage in one artery 90%, other one is 80%. So over the period of time, other artery is going to get blocked.
yes. Unless you
Here
change your
you need
lifestyle.
not. Yes, yes. So again, you have to repeat plasty and all these things. But here you need not have to do such things again and again.
Right. Okay. Okay. So this is excellent information that you've shared with us. Thank you very much, Dr. Gupta, for being on the show. Thank you very much.
You're welcome.
If you like our videos, do subscribe, like, and share. Thank you.